The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thank you for tuning in to another edition of The Fact Is. Today, we're going to be talking about the holiday season. The holiday season is coming up as we speak. People are getting ready for Black Friday, getting ready for Thanksgiving, and getting ready for Christmas. There's so much holidays coming in the next month, but what does that mean for us and what does that mean for COVID? So we're going to take a look at two particular articles in the news, recent news, about the holidays and COVID, and what do the officials have to say about the holidays. So taken from the Desert News, this is from November 16th, Dr. Fauci reveals what your family should do for Thanksgiving. Again, this is from Desert News, desert.com. Dr. Anthony Fauci has a good feeling about Thanksgiving, assuming families are vaccinated. Fauci, the director of the National Institute of Allergy and Infectious Diseases, said Monday at a bipartisan policy center event that families can feel good about the forthcoming holidays if they're vaccinated, according to The Hill. Now, if you're not vaccinated, apparently it's all doom and gloom, and you will potentially die. Quote, if you get vaccinated, and your family's vaccinated, you can feel good about enjoying a typical Thanksgiving, Christmas with your family and close friends, he said, as per The Hill. When you go to indoor congregate settings, go the extra mile, be safe, and wear a mask, he added. But when you're with your family at home, goodness, enjoy it with your parents, your children, your grandparents. There's no reason not to do that. There you go, folks. Ensure that while you're with your parents and your children and your grandparents, make sure that you wear a mask because, it's better to go that extra mile to be safe. This isn't exactly news from Fauci, who said earlier this fall that the fall holidays will be safe for families. Quote, if you're vaccinated, you and your family members are vaccinated, you can enjoy the holidays. You can enjoy Halloween, trick-or-treating, and certainly Thanksgiving with your family and Christmas with your family, Fauci said on ABC News this week. That said, there have been some questions about children in Thanksgiving. The coronavirus vaccine has been approved for children 5 to 11, but that means they won't be considered fully vaccinated in time for Thanksgiving. Dr. Leanna Wen, a professor of Health Policy and Management at the George Washington University Milken Institute for Public Health, recently told CNN that children shouldn't behave like they're fully vaccinated yet, so families should put proper precautions in place. Quote, it is hard for everyone to stop their lives prior to the get-together, Wen told CNN. I'd encourage people to do their best to reduce the risk in that period. People going to school and work where they will be around others of unknown vaccination status should wear high-quality masks when they are indoors. Do not go to crowded indoor bars or restaurants or get together with other people indoors during that period. So we have one official says it's okay to get together, you can go indoors, but wear a mask. You have another official that says you really shouldn't go out, go anywhere. If you have two government officials debating about what the right policy is, which is the right policy? What is the right science? Who are these people that are making these rules? And who is the real expert? Now, we're going to take a look at Canada. And how is Canada bracing for the coronavirus during the upcoming holiday season, which is Christmas? And we're going to be taking a look at a particular article that references Dr. Theresa Tam. Dr. Theresa Tam would be the same as a Dr. Fauci. Taking from LakeSuperiorNews.com from November 15th, 2021. Christmas caroling is unsafe, says Dr. Theresa Tam. The Chief Public Health Officer said singing indoors is not recommended this Christmas, even among people who are fully vaccinated, Blackstock reporter says. Quote, in the wintertime, going inside with a lot of people shouting and singing is not the best idea if COVID is circulating and accelerating outside your front door, Tam told reporters. Tam also advised that anyone gathered for an indoor event this winter, even fully vaccinated people, should keep their windows open, particularly if ventilation is not optimal. Tam compared the coronavirus to secondhand smoke, and that should be avoided if possible. We've learned how the virus can linger in fine aerosols and remain suspended in the air we breathe, much as expelled smoke lingers in poorly ventilated spaces, said Tam. This is why opening a window helps reduce the risk, and why wearing a well-fitted and well-constructed mask is important when you're spending time in indoor public spaces, particularly if ventilation is not optimal. The risk for surges in disease activity is likely to increase with more time spent indoors. Dr. Howard Najo, Deputy Chief Public Health Officer, echoed Tam's advice. Can we open windows? Said News. Can we give permission for everyone to be comfortable continuing with wearing the mask indoors, even for family members? It is a good idea to consider wearing a mask for everyone, vaccinated or not vaccinated, and taking other measures to increase ventilation, said Nuge. Open windows to have more drafts. This comes after instructions in October from Ontario's Chief Medical Health Officer, Dr. Kieran Moore, that Halloween trick-or-treaters should not sing or shout for their treats. They'll have masks on, it's just not to yell too exuberantly. I think the purpose of that comment was to not aerosolize, and it's just a risk reduction strategy, Moore commented on his guidance. Clearly, you have to make your presence known to get your treat, and you have to be able to knock as well as ask for the treat. We just ask not with a high volume that could potentially aerosolize. Dr. Kieran Moore, who made $265,823.25 in 2017 when he was the medical officer in Kingston. And he held that position until recently in 2021 when he was appointed by Premier, my friends, Doug Ford. There's no information of what he's had yet of 2018, 19, or 20 salary, but we're just going to say $265,000. $265,000 of public money as he's paid by the state. And he's telling kids not to yell trick or treat or not to sing? Please correct me if I'm wrong, and I welcome any and all feedback through Facebook, through our Twitter account, through droidscanada.com, and tell me your personal experience of singing on Halloween. When have you ever knocked on a door and sung for candy? And when have you ever screamed trick or treat at the top of your lungs and sprayed people with spit? And this person, Dr. Kira Moore, is going to take $265,000 a year, if not more, and his way of stopping coronavirus is telling kids not to scream and sing on Halloween. This is up in line with the medical officers in British Columbia that told people at the height of the pandemic to have sex through glory holes. Take a look at our past episodes on that one. Sex with glory holes. Dr. Theresa Tam said to have sex with a mask on. And these are the people in charge of getting a hold of the coronavirus. When you have people that are telling you not to scream and sing loudly Christmas caroling because COVID will linger at your door, just lingering there in the cold, waiting for someone to come out like a mystical, magical boogeyman. And we have Pfizer, and we have Moderna, and we have those representatives that are going into the government and lobbying the government to get more vaccines into people's arms. We have a former CDC chairman is now on the board of directors at Pfizer, where Pfizer paid $16 million to lobby the federal government in America, and now pushing through a third vaccine, approving a booster shot. They are posting record numbers of profit, taking from the public purse. Well, people in charge are not doing anything but accepting get more boosters. It's okay, we'll just get another booster. Just get another booster shot. Keep on wearing your mask, get a booster shot. Everything's going to be okay as long as you keep on getting a booster shot. Booster, booster, booster. When those same individuals were saying, all we need to do is get herd immunity. Herd immunity. Herd immunity. We need to get herd immunity. If 70% of the population can reach herd immunity, we're going to be A-okay and everything's going to be fine and we can get on to life as we know it. They've changed their tune to now we need a booster. You have to have a booster. But meanwhile, when they were saying those words, we need herd immunity, you have to realize that humans are not herds. We are not a herd. Herds don't travel across the world in a jet plane. Herds do not go to Glasgow to attend climate crisis summits and have an entourage of 30 cars while preaching about how to reduce emissions. The idea of herd immunity works when you're dealing with 2,000 head of cattle in the middle of nowhere, in the middle of Texas, ensuring that your disease, your herd does not get wiped out because of one disease. But those herds aren't traveling to different states. They're not traveling to different countries. They're not hopping on planes, meeting with other herds, and then jumping off another plane where another cattle is being mixed. Humans aren't herds. But the idea was everyone gets vaccinated, 70% of people get vaccinated, and my, oh my, has that changed. Because that is no longer what scientists or bureaucrats say is going to end this pandemic. Get as many vaccines and booster shots that we can get into people. More vaccines, more vaccines. More boosters. If we need a third, fourth, and fifth booster, let's keep at it. Israel has now stated that they will have a booster shot. America is stating that they will get a booster shot. And people are getting a booster shot. And in Canada, they're talking about a booster shot. And in Austria, if you are vaccinated, you're allowed to go out. And if you're unvaccinated, it's a lockdown, mandatory lockdown. Well, in Australia, lockdowns. In Sweden, now a vaccine passport country. The province of Ontario in Canada, vaccine passport. The province of Alberta, vaccine passport. Passports and more vaccines is the solution of the people that create these policies. The same people that are saying, don't sing at Halloween and don't sing at Christmas. And if you get together with your family and your friends and you're all vaccinated, wear a mask. Public health officials such as Professor Niel Ferguson. And here's an article from the BBC. Professor Niel Ferguson has quit his government advisor on coronavirus after admitting an error of judgment taken from May 6, 2020. This is a person that was in charge of COVID pandemic relief, or helping and coming up with policies. Professor Ferguson, whose advice to the Prime Minister led to the UK lockdown, said he regretted undermining the messages on social distancing. He was the person in charge and suggested to shut down. The Telegraph reported that a woman he was said to be in a relationship with visited his home in lockdown. Health Secretary Matt Hancock said it was extraordinary and that he took the right decision to resign. He told Sky News that it was just not possible for Professor Ferguson to continue advising the government. Mr. Hancock said the social distancing rules are there for everyone and are deadly serious. Scotland Yard said Professor Ferguson's behavior was plainly disappointing, but officers do not intend to take any further action. Number 10, which would be the Prime Minister, 10 Downing Street, said the Prime Minister agreed with his decision to resign, but Professor Ferguson was not told to do so and has made the decision himself. Social distancing regulations are there for a very clear purpose, the Prime Minister's spokesman said. Professor Ferguson's modeling of the virus's transmission suggested that 250,000 people could die without drastic action. 250,000 people could die if lockdowns weren't made. How many people have died in England from the coronavirus? 143,000. 143,000 people have died. Not 250,000. Now you can make the argument to say, well, lockdowns, and lockdowns did make a difference. Well, there's no way to actually tell if lockdowns did make a difference. And if lockdowns did make a difference, then why did Professor Ferguson meet with his mistress to get together and have a shag fest? Why is it that he was allowed to do that and he didn't see a problem with doing it? Because people that make these rules do so without thinking about them. And they do so by taking your money, taxpayer money, and act like idiots. When Professor Ferguson, the adulterer, was asked by the Imperial College of London reporter Dr. Sabine Van Asselin and Stephen Jones on October 6, 2021 at imperial.ac.uk. In his vaccine rollout, Professor Niel Ferguson also discussed the current vaccine rollout to teenagers and the booster program. Yes, he's still working, collecting public money. He said, we need to be a little less cautious in accelerating second dose rollout in teenagers where possible, because we know that one dose of these vaccines against the Delta variant has a minor impact on transmission. It's only after 2 doses we start seeing a significant impact. He continued, I'd like to see us be a little bit more aggressive in rolling out booster doses as well, because the sooner we can, the sooner we will reap the benefits. But this is the same professor that had an affair during lockdown. Well, it was before lockdown, but he continued it during lockdown to go meet his mistress on the other side of London and have sex with her. But from thetimes.co.uk, and this is back in early January 10th, 2021, and he says, and this is just the title, there's an interview, we're not going to get into this full interview at this point. But Niel Ferguson puts his faith in the herd immunity. So many of us have now had COVID that the vaccine program should quash the virus by autumn, says Professor Lockdown. That by fall, don't have to worry. Pandemic's going to be over. And that, it rages on in England. Because, again, incompetence rules the day. I'd like to thank you for tuning in for another edition of The Fact Is. I'm your host, Hollis Grant. You have yourself a great week.
Dan, what happens every Thursday?
That would be DCR Droids Canada Radio.
And what time is it out on Thursday?
That's from 9 till 11 p.m.
Dumb question. Where do you find it?
You find that at accessradio.ca.
And what's the best part?
It's free.